Hello, everyone. This is Dr. Van Merkle, and I'm here to share today with what my blood test is that I had tested on September 13th, uh, 2021. I do this once a year. Sometimes I do parts of it more often than that, but you'll see the main test that we do here. And for those of you new to science-based nutrition, this is a type of testing that we do. Now, this is much more extensive than our normal foundational blood test or our baseline blood test. But there's some things that I want to check on myself or that I want to learn more about the blood test and see how what's happening in my life can affect the test results. And there's some interesting things going on with this blood test that I wanted to share with you, as well as show you what a comprehensive test could look like. All right. Again, I am Dr. Merkle. This is my blood test. And this test took 29 tubes of blood. And maybe you've seen the picture of how many tubes of blood they took from my arm, but it was 29 tubes of blood. And actually, that's less than a pint you would give if you donate a pint of blood. So I know it looks like a lot of blood. It's not just 5 tubes like the normal foundational test is 5 tubes, but it's way more than the baseline test of tubes is. So anyway, we'll just start here at the top on my blood test. Again, it's dated 9/13. It's compared to almost a year ago. And my glucose A1C are great. Uric acid is good. So my kidney function is great. In fact, the BUN is low. That's good. So all my kidney function is good. My chloride is just a little low. And chloride is needed to make hydrochloric acid, one of your digestive enzymes. So that's low, and along with that being low, then we're going to see some other things be associated with the low digestive enzymes, that kind of thing. And I have started increasing my digestive enzymes, especially my betaine, and I'm noticing that I do feel a little bit better since this blood test. So my calcium is a little bit low. I don't take a lot of calcium, so maybe that's why. Protein is low, and I know my chloride only dropped a little bit, but I do need to get more protein, basically, on an ongoing basis. Moving on down, liver function looks pretty good. My SGOT is a little high. Okay, just to review, my bilirubin is good. Alkaline phos, creatine kinase, and LDH. Those are big numbers when you're looking at inflammation, tissue breakdown, or other autoimmune disease, degenerative diseases, and those are all optimal. And we like to see that. Now my SGOT is a little bit high. Now the clinical range is 40. I want you to be, the SBN range is 10 to 26, so it's just a little bit. The serum iron is back to normal, but you see how the ferritin and serum iron basically flips places a little bit on this, which is good. The serum iron is the active form of iron your body can use to make red blood cells, so we're good on that. Cholesterol went up to 196. That could be because it's something that I'm going to share with you. It could be associated with that. LDL went higher, etc. And the C-reactive protein dropped dramatically from 85 down to 7. I don't remember what injury I had, but there was something a year ago that caused that. And now it's down to 7. That's all very good. White count is still low, a little bit low. Now, that could be due to a couple different things, but I'm going to say it's probably associated with low protein. Along with the hemoglobin being low, hemoglobin is protein, so right there, we need some nutrients there. Polys came down from 77 that were high. Now they're a little bit low. Again, these are borderline. You just need to keep an eye on these, but nothing critical or anything that we see. Going on down, my inflammatory factors are good. The CRP, where is CRP? Here is a little bit high, but it's down from 85 down to 7. We want you to be below 6.7. That and the SED rate is really good at 2. So that one is down. The vitamin D, I need to get more vitamin D, even though I know I've been in the sun a lot, and I had a nice tan in September, but I'm still low. I'd stopped taking my vitamin D during the summer, but Looks like if I want to be close to 80 or 90, I'm going to have to take vitamin D more regularly than what I am. So I need to do that. The DHEA is up a little bit. Now my testosterone total is good at 901. It nearly doubled from where it was a year ago, so that's good. But my free testosterone is a little bit low. And that'd be better if it were doubled. And so I think my vitamin D levels could be a factor in there. My protein levels could be a factor. And something else I'm going to share with you here in a minute could be associated with that being elevated. The SHBG being elevated. SHBG needs to be low. This tends to go high. And I'm going to be talking about these hormones when I do a hormone little webinar, a little training on that. And I'll get that. You'll have that in just probably a week. I'll have that available. So SHBG is very important, and there's some things I'm taking for it. Looks like I need to take more to get that down. The PSA went from 2.7 to 3.7. That may be related with the SHBG going up, maybe associated with the testosterone or even low vitamin D. So I've got to work on that. Nothing major here shows up. A little bit low, a little bit low. It could be I need more fatty acids, more fish oils. And now we have the coronary panel shows us isoprostane is high. It doubled, and this is an inflammatory factor. That, and we see interleukin 4 down here is high. And then we see a thrombin, antithrombin complex is very high too. And a prothrombin fragment. Okay, now what I think has happened, and I on the very first part of the report on comment sections, I had a very bad, extensive case of poison ivy. Both legs, both arms. It had just broken out, and it was well, anyway, it was bad during this time. And I think some of these inflammatory markers, especially the F2, as well as definitely the interleukin 4, could be very high because of the poison ivy. It's an allergic reaction element here, interleukin 4. And so I'm much better on my, there's still some redness, some irritation from the skin, but it is probably 90% cleared up on my arms and legs. And so I'm going to test these things again in probably a month and see if they're coming down a little bit. So I think it could be the antithrombin, the inflammatory process that occurred because of this could be creating a problem. Okay, so now this is a very extensive test. This was 29 tubes of blood. Our standard panel stops about right here at vitamin D, and now we're at the hormone panel. We have the cancer panel, and then we have the advanced coronary panel, the ACP. And as you know, this is based on the Cleveland Heart Lab. We added a few things to it. And then we've got other tests in here that I added to it, like the C-peptide, if you remember what that is. It's your diabetic factor, the DHT. This is a bummer that it went up. This is one associated with hair loss. And it went up to, it was a 49. It's up to 70. And again, I don't know how much the low protein, the inflammatory factors have a factor on that. But hopefully we'll see that come down. The homocysteine is high. I'm almost 100% certain that that's associated with the poison ivy inflammation problem that I had. So leptin, that is leptin is your hunger hormone, and that's low. That's good. And so you can see these other ones down here. And but this is a very extensive test. Generally, we're not going to run all of these. But just as an FYI, I want to show you that the mumps, rubella test that I did, I tested those a few months ago, a couple years ago. Where are those? Oh, here we are, mumps and rubella. I have extreme high levels of antibodies to mumps and rubella. I didn't test any others, but I had these as a child. I had these diseases, mumps, rubella as a child, mumps, measles, etc. Do we see measles there? No. But I had mumps and measles and all these other chicken pox, all these other things when I was a kid. Oh, there it is, chicken pox. And you see that my antibodies are code blue high. Now, I'm 64, and after, over probably close to 50 years, my body still has great natural antibodies. It'd be interesting to test someone who had a vaccine to see what their antibodies are. But anyway, I can't test my girls, my daughters, because they've never been vaccinated these things. So anyway, that is my test. Now let's just go on through and look at some of the other values. The hair test. Here's my hair test. Yeah, with ranges. In the toxic elements isn't too bad. You see my mercury went down, lead looks okay, but here I moved to a new place, and my copper level that was at 42 jumped up to 120. That's extremely high, and then this was back a year ago, and I'm going to get another hair test done here in just a few weeks when my hair grows out a little bit more. But I need to see that copper level come down, because if that copper level is still going up, that's going to play havoc with all my hormones, inflammation, and everything else. So the copper is way too high, and it's probably one of the most significant factors I see here. Now on my UTEC, urinary toxic element challenge, again, when I collected just 6 hours a year, nothing showed up. But then when I use DMSA, I've got very high levels of lead and mercury. Now, I've tested my family, brothers, sisters, aunts, nephews, and nieces. And my family, the Merkle family line, tends to have an impaired ability to efficiently eliminate lead and mercury. Now, I used 1,200 milligrams of DMSA for the challenge. I had been using 1,200, 900. I went down to 900, and I thought I'd go up to 1,200 again. And I see high levels of lead, extreme high levels of lead, and extreme high levels of mercury. So I'm going to test it again, but I need to make sure I stay on DMSA, because, as I said again, my body, the Merkle system, the Merkle genetic line, just doesn't get rid of mercury and lead very efficiently. And we do have other problems. And I've talked about some of those cases, other family members, and their high levels of lead and mercury. So hopefully that has been of a benefit to you. Don't want to prolong this or go too long on this video, but hopefully this gives you an idea of what I do. And even as well as I eat everything else, the vitamins I take, nobody's perfect, and we all have things we need to work on a regular basis, all the time. And so good health is a journey, not a destination. So hopefully this has been of help to you. If you're new to SBN, check out our website, contact us. We'd love for you to be part of science-based nutrition and maybe be an SBN member. If you are a regular person just checking things out and looking around for help with your healthcare problems, we would love to help you with your healthcare problems. And science-based nutrition has members all over the country. We may be able to find somebody in your area. So I'd like to thank you for listening. Hopefully this has been a benefit to you. We'll have be sure and look at our other videos. You'll learn something there too. Have a great day. I'm Dr. Merkle.
If you're a doctor, becoming a science-based nutrition member is easy. For patients, SBN will assist you in finding an SBN-trained doctor in your area. Please visit www.sciencebasednutrition.com for more information on becoming a member or finding an SBN-trained doctor.